We're doing this today as a community event to bring the community together, coinciding with Ramadan. We're bringing all three clusters together. That's South East, City and South, and East Cluster of Cardiff. So joining together all the clusters from South East. All of those clusters have a very, very low immunisation and vaccination rate and screening. So the purpose of today is to come along, celebrate Ramadan, have a really lovely evening together, women and children only, offering vaccinations spontaneously. We've got a great panel of paediatricians, obstetricians, a GP and somebody from public health. So they'll be taking questions from the audience. And, hopefully we will send people away being more informed. We've got lots of activities, lots of toys, bouncy castles, Connect Four. I'm sorry, grown-ups can't go on the bouncy castle. For adults, we've got a lot of exhibitors, screening, we've got BP, weight, we've got the police here with lots and lots of donations. There are the third sector agencies here that offer the social prescribing, social care to patients. So really, really pleased to see those.
So we know that there are quite major health inequalities, but unfortunately within certain communities, uptake for things like screening and immunisations is a lot lower. So we felt that if we could bring our community and our healthcare professionals together to answer what those questions are and hopefully dispel the myths around a lot of those things, then we thought that maybe it will empower our patients and our communities to really feel confident about why they need to do this and go ahead and get their screening done and their vaccinations. We know that lots of cancers are not detectable because they just simply don't present with symptoms. There are various different cancers that by the time their symptoms present, it's just too late. But specifically for bowel screening, cervical and breast screening, we have these opportunities. So if we can pick up these cancers at the early stages, it means that we really can save lives. So we know that we can get early help, early intervention, which means that patients are going to have a much better prognosis. But if we look backwards into our history, measles, mumps and rubella, for example, children did die of these diseases. So what we're able to do is protect ourselves and protect our children so we can lead hopefully healthy, long lives.